A 70-year-old madman presents with multiple tense blisters on his abdomen, groin, and inner thighs. The lesions are pruritic but not painful. On examination, the blisters are intact and filled with clear fluid. A skin biopsy shows subepidermal blisters with linear deposition of IgG and C3 along the basement membrane. Which of the following is the most likely diagnosis? A. Bullous pemphigoid. B. Pemphigus vulgaris. C. Dermatitis herpetiformis. D. Epidermolysis bullosa acquisita. E. Stevens-Johnson syndrome. A. Bullous pemphigoid, caused by autoantibodies against hemidesmosomes, which anchor the epidermis to the dermis, leads to tense subepidermal blisters and linear IgG-C3 on immunofluorescence. Why not the others? B. Pemphigus vulgaris, flaccid blisters and mucosal involvement, caused by antidesmoglein, desmosomes, intraepidermal blistering. C. Dermatitis herpetiformis, papulovesicular rash on extensor surfaces, associated with celiac disease and IgA deposits at dermal papillae. D. Epidermolysis bullosa acquisita, similar presentation but rarer. Immunofluorescence shows deposition in the dermal side of the BMZ. E. Stevens-Johnson syndrome involves mucosa and epidermal necrosis, not classic bullae. Question 2. A 68-year-old woman presents with an itchy rash that started as urticarial plaques and evolved into tense blisters over a few days. The oral mucosa is spared. A biopsy shows subepidermal blistering, and direct immunofluorescence shows linear IgG deposition at the dermal-epidermal junction. Which of the following structures is the target of the autoimmune process? A. Desmoglein 3. B. Keratinocytes. C. Hemidesmosomes. D. Collagen type 7. E. Langerhans cells. Correct answer C. Hemidesmosomes. Bullous pemphigoid involves autoantibodies against BP180 and BP230, components of hemidesmosomes, leading to subepidermal blisters. Why not the others? A. Desmoglein 3, seen in pemphigus vulgaris, intraepidermal mucosal involvement. B. Keratinocytes, not a specific autoimmune target. D. Collagen type 7, target in epidermolysis bullosa acquisita. E. Langerhans cells, antigen-presenting cells, not involved in blister formation.